we needed better facilities for our providers to work in and for our patients to be seen in the outpatient setting. And so we did a strategic plan. The facility master plan called for a medical office building. And since I've transitioned into my role with mission in a system capacity, I've been able to continue to shepherd the construction of the medical office building. The name is going to be the Mission Health Mauzy-Phillips Medical Center. It's 30,000 square feet. It's 2 stories. We've got primary care and orthopedics and lab services and x-ray and pharmacy on the first floor. And on the second floor, we've got endoscopy, where you might get a colonoscopy or something like that. We've also got general surgery and wound care and rotating specialists from Asheville and Boone, all on the second floor. The primary impetus for having the medical office building constructed was to provide a great home for primary care and our other outpatient services that needed a better place. It was also to improve access to those services, because parking in some areas right now is either non-existent or far away from where the service is actually provided. So we'll be offering our existing services, but greatly enhanced, and we'll also have more capacity to have more rotating specialists come through from other communities. We do gain a lot of advantages for patients and for our providers by having the medical office building on campus. If the surgeon has a patient that's in the hospital, he or she can go from the medical office building really quickly and check on that patient and come back and not have to make patients wait. That's great. It helps patients out because they don't have to wait for the doctors to get there by driving half an hour between the hospital. And it helps our providers out. They can see more patients during the day. I think we're pretty excited. You know, there had been a whole lot of making do with what we had, which is completely understandable. But in order to make this medical community sustainable for the next generation, we really needed to do what a friend of mine calls a forklift upgrade on the environment in which we were providing care. At the same time, though, we really took a lot of time to make sure we were doing it right. Very proud of the work we've done to engage with the providers here, to say what are the opportunities you'd like to see us, capitalize on for the layout of this medical office building. We did a lot of research across the country with other nationally known providers to say, how do you approach your clinic design? We talked to Mayo Clinic, we talked to Intermountain Healthcare, we talked to Geisinger, we talked to Mercy Health. All of those providers were very forthcoming and shared what works for them and what doesn't work. And so the Mauzy-Phillips Medical Center is a manifestation of our interpretation of all that provider input and all that research input, and some of the experience we've had from building our own buildings as well. Some of the aspects of the design that we're particularly excited about are convenience for patients. There's a single central entrance. You park, you go to the entrance, you go in, and then somebody's right there waiting for you and will help you get to where you need to go. We've worked to minimize the number of steps that patients have to take to get to their place of care. We've worked to minimize the number of steps that our providers have to take care of patients. We've created what we're calling teamwork areas, where caregivers in the clinic can talk to each other about the care plan that they've got for a particular patient. They don't have to look all over the clinic to find each other, which is actually what's happening now. And they can do it in a way that other patients won't overhear the conversation. I believe and hope that patients will have a tremendous experience when they come to see providers at this medical office building. We had patient focus groups, so we got a sense from folks in Spruce Pine and surrounding communities what they wanted to see in a medical office building. We've incorporated their comments into the design and the finishes that are in the building. We also had patients participate in the design meetings themselves. That wasn't just a sense of doing the right thing, which of course it is, The leadership at Mission, Jill Hoggard Green is the COO for the system. She was very explicit in her directive to us to go cast a wide net, figure out from all the sources that you possibly can what's the best way to build this building. And so that's what we did, and I'm pleased.